This is Livy, and I'm going to be looking at treating heart disease. So there are two common treatments for coronary heart disease. The first is statins. Statins are drugs that can be taken to decrease blood cholesterol levels, and this decreases the rate at which fatty materials build up. As with most medications, statins can have side effects. And the second treatment for coronary heart disease is stents. Stents are inserted in order to keep coronary arteries open. Over time, because of irritation caused by the stent, the artery can begin to narrow again as scar tissue builds up. Drugs must be taken to prevent blood clotting or solid lumps of blood forming on the stent. So let's just recap these two treatments as stents and statins. One is a physical structure inside the coronary arteries, and statins are drugs. So the two main treatments, just again, are stents and statins. So there are different types of treatments for heart diseases, and they have advantages and disadvantages. So drugs, such as the statins I just mentioned, the advantages are that they're often cheap to buy and they don't require surgery. However, they may have side effects, and the patient has to remember to take them. The other is mechanical devices. The advantage of these is that they can be used in a case where a donor organ is not available, so there's no waiting list. And disadvantages are that they require a power supply and may eventually wear out and need replacing. And finally, transplants. Successfully transplanted organs won't wear down and will function like the replaced organ, but the disadvantages of them are that they require a suitable donor and immunosuppressants, which are drugs that reduce the effects of the immune system and therefore increase the risk of the patient getting another disease. So let's just recap on these, the different treatments and their advantages. We know that transplants don't wear out and function like the replaced organ. Drugs are cheap and do not require surgery. And mechanical devices are used if a donor is not available. And what are the potential disadvantages of using transplanted organs? As I just mentioned, we know that they may be rejected, and you also need to take immunosuppressant drugs, which increase the chance of developing a disease. So let's just recap on the role of immunosuppressant drugs and why this could be a disadvantage. It's because they're used to stop the patient's immune system from rejecting a new donor. However, because you have a lower immune system, you're also not protecting yourself from colds and other diseases. So let's just recap on that type of drug which is used to decrease blood cholesterol levels. This is statins. So that's everything for treating heart disease. Thanks very much for listening.